After performing hand hygiene and ensuring privacy, introduce yourself to the patient. Then identify her using two
I'm going
identifiers.
to be your nurse. Can you state your name for me, please?
Gail Sharp,
And your birthday.
8/22/1951.
All right, thank you.
Before cleaning a patient's dentures, determine if the patient can clean her own dentures independently or if she requires assistance. Ask the patient about denture care product preference. Apply gloves and begin by removing the dentures from the patient's mouth. If the patient is unable to do this for her upper denture, grasp the upper plate at the front teeth with your thumb and index finger wrapped in gauze and pull downward. To remove a lower denture, gently lift the denture from the jaw and rotate downward to one side. Place the dentures in a denture cup if they will be cleaned at the sink. If you'll be cleaning them at the bedside, place the dentures in an emesis basin. To clean the dentures at the sink, place a washcloth on the bottom and fill the sink with about an inch or 2.5 centimeters of water. Apply the cleaning agent to the toothbrush and brush the surfaces of the denture. Be sure to hold the denture close to the water and hold the brush horizontally. To clean the outer portion of the teeth, use a back and forth motion on the biting surfaces. Use short strokes moving from the top of the denture to the biting surfaces. Then hold the brush vertically and use short strokes to clean the inner surfaces of the teeth. Finally, hold the brush horizontally and use a back and forth motion once again to clean the undersurface of the denture. Then rinse the denture thoroughly in warm water. Remember, if the water is too cold, the dentures can crack. If it's too hot, the dentures can warp and will no longer fit properly in the patient's mouth. Repeat the cleaning and rinsing process with the other denture if the patient has one.
All right, the dentures are all clean. We're going to just rinse your mouth out now.
Have the patient rinse with mouthwash to clean the oral cavity prior to inserting clean dentures.
Just swish that around in your mouth, please, for me.
If the patient needs help inserting her denture, press it firmly to the gums to seal it in place. If the denture is dry, then moisten it before inserting it into the patient's mouth. Then insert the lower denture using the same process. If the patient uses adhesive, apply it to the undersurface of each denture before inserting it. Ask the patient if the dentures feel comfortable. And assist the patient with drying her face. Return or dispose of all used supplies. Remove and discard your gloves. And perform hand hygiene. The patient may prefer to store her dentures to rest her gums or to reduce the risk of gum infection. If so, store the dentures in warm water in a denture cup. An effervescent cleaning tablet may be added to the cup at the patient's request. Be sure to label the cup with the patient's initials and put it in a safe place to keep the dentures from getting lost or being accidentally thrown out.